Hello, my name is Patrick Ash, and this is my oral presentation on the medicine Indacaterol. Indacaterol just came out on the market not too long ago, was approved by the FDA, and what it is a long-acting beta agonist, a LABA, and it's used for patients with COPD. What it does is it goes into your lungs via dry powder inhaler. You put it in this little capsules. You put it in this neohaler, it's called. Has a little spring with a needle. It pokes holes in the capsule that you put in. You put it in your mouth and you inhale deeply. Goes into your lungs and it binds, goes right onto the beta receptors as if like a key in a lock, basically. And it relaxes your smooth muscles so patients with COPD can breathe. So let's start with the first slide. The first slide here says the agenda. Talks about today's current LABAs that are in use, solution, budget, and conclusion. So, second slide, more daily dosages. That is the current problem with today's LABA, long-acting beta agonist medications. The current LABAs only last up to 12 hours, so you have to take them twice a day minimum. Most patients with COPD are on other medications for their disease to help control it so they can breathe better. So anything that we have that's going to allow them not to have as many medications per day is going to increase their patient compliance. So we want to lower the dosages. So that is one problem with today's medications. More daily dosages. Next slide, decrease patient compliance like we were just talking about. That is one of the main problems today, decrease patient compliance. Patients with COPD, they take numerous medications daily, and they get sick of it, If you have to take 12 medications a day, you're not going to want to keep doing it every day for the rest of your life. So anything we can do to decrease the number of medications that they have to take is going to increase your patient compliance. A study done at the St. Louis Veterans Affairs Medical Center states that probably the single most important action that healthcare providers can take to improve compliance is to select medications that permit the lowest daily prescribed dose frequency. So there you have one study telling you that increasing your patient compliance by lowering the daily dosages prescribed. Increased healthcare costs, another problem with today's medications for COPD. Patients receive numerous medications, it increases the cost of the healthcare system, plain as that. National Health, Lung, and Blood Institute provides the single current estimate of total direct plus indirect annual cost of COPD in the United States at $38.8 billion in 2005 dollars. This is 7 years later, so you can imagine how much more it's going up. And waste of time, another problem with the medications today. If you have to take your LABA twice a day, that's 2 times an employee has to come and administer your medications. If you cut that in half, with Indacaterol, this new medication, you only have to take it once a day. That increases the amount of time that is not wasted. So you have less wasted time. Solution is the Indacaterol. It's made by Arcapta. It's a medication company, and they have the neohaler, which is the little plastic pocket size, nice little dry powder inhaler, DPI, that actuates the little capsules that hold the Indacaterol. The little capsules are full of the medication, goes into this DPI, dry powder inhaler, the neohaler, and it has a little spring with pins on it, and it pokes holes into the Indacaterol capsules, and then you stick it in your mouth and you inhale deeply, and the dry powder that's inside these little capsules goes down into your lungs, and it goes into the beta receptors, which act kind of like a key into a lock, goes in there and relaxes your smooth muscles so patients with COPD can breathe better. Our Captus Neohaler, like I was just stating, dispenses the Indacaterol as a dry powder inhaler, and it has benefits such as only 1 time a day. It's 1 dose daily, lasting 24 hours. That is huge. Just came out on the market, brand new, FDA approved. Increases your patient compliance, like we were talking about. You want medications that is going to increase your patient compliance. Decrease wasted time. You have less healthcare costs, all these things, great things that can be changed just by switching to this new medication. The budget. Another great thing about this new medication, Indacaterol, is it's in a DPI, dry powder inhaler form, So most of your doctors and your respiratory therapists already know how to administer dry powder inhalers. You have other ones, and patients take these already. So pretty much all you have to do to change your ways right now of medications is you just have to learn how the Indacaterol is used, how it works, and how to actuate the inhaler. And that's basically it. Minimal expense. You don't have a big budget. All you have to do is teach the doctors and respiratory therapists, and then they in turn will teach their patients. So, it's a cheap way to switch to a new medication. Conclusion: Indacaterol is a 24-hour long-acting beta agonist. It lasts longer, current medication, easy to use, it's pocket size. You can put it right in your pocket wherever you go. You can have it, take it. Patients with COPD go out. If they forget to take it, it's right there in their pocket if they want it, or in their purse. Easy to use. Pocket size, like we were just talking. Increases patient compliance, which is great. Decreases healthcare costs, which we know is a huge problem in the United States today. Less dosages required by the patients, and it's less wasted time in the healthcare facilities. That's all I have. Hopefully we can get this medications changed, and we will talk later. If you have any questions, feel free to contact me. Thank you.